Hey everybody, Dr. Barnes here. I wanted to hop on and just give you some information around headaches. So there's a lot of confusion about headaches and really the type of headache that you get, or if you have a friend or family member that gets headaches, like as far as where you feel them, can really tell a lot about what's going on in the body. So remember, we always have to think about causation. What's going on? Where is this coming from? If you just get a headache every 4 or 5 years, or very infrequently, I mean, sometimes I'd say it's not worth reading into, but if there's repeat patterns that are going on in your body, like these are some ways you can identify this. So when we're talking about headaches that occur like, in your forehead, or the ones that occur behind the eyes, we always have to look at and think about the liver involvement. And so a lot of times it can be, viral based. So are there chronic viruses that are trapped in your body? The most common ones would be like Epstein-Barr virus, cytomegalovirus, the herpes zoster virus. The liver does a lot of work with viruses, so I would check that. Another thing can be blood sugar imbalance, or another term for that would be hypoglycemia. So I was just having a conversation about this with a patient this morning, and we were talking about why she couldn't lose weight, or just why she didn't feel well. And so, you can definitely get something like a continuous glucose monitor to really get an idea of what your blood sugar does throughout the day. But a lower tech way is you can just get a glucometer, like what a diabetic uses, and you can do finger pricks and measure your blood sugar. So oftentimes I find it's really revealing that if you're, physically don't feel well, all of a sudden at 3 o'clock, taking a blood sugar reading at that point can be really eye-opening as far as like what's actually going on inside of your body. So for liver support, or I should say for headaches of those types, again, if you get them behind the eyes or in the forehead, it's really important to look at supporting your liver. So I'm a big fan of regular castor oil pack usage, taking the right kind of herbs for your liver. So things like TUDCA, N-acetylcysteine, things like milk thistle, schisandra berry, right? And a lot of times there are herbal blends of supplements that are liver specific that you can take that, will encompass a lot of those things. Also with liver challenges, there's a big component to emotional stress with that. So, again, a lot of times if you're like, I'm doing the right things and I'm eating the right way, I'm taking the liver detoxes, I'm doing the castor oil packs, but still struggling with those symptoms, then perhaps you have to look at what's the emotional component that your body has maybe an unresolved conflict over. And I know that can sound really woo-woo or weird, but there are many books that cover the scientific explanations of this. The Body Keeps a Score is one of them. But we know, there's even specific fields like NET and other, EFT, emotional freedom technique, that addresses the linkage between certain organs of the body and specific types of emotional conflicts that you're going. So, if you're interested in getting to the root cause of your issues, there's always a way to dig into and figure that out. Obviously, if you don't care, well, then just keep treating your symptoms, because, how well is that working out for our country? So behind the eye headaches, look at blood sugar, look at liver, look at, emotional, stress from that, and act accordingly. If you need any help, reach out. I'm here to help.